Hello class, this is Emergency Medical Responder Chapter 16, Childbirth. Let's discuss the competencies we're going to cover in this chapter, and we'll begin with the EMR definition of special patient populations. This is when the EMR recognizes and manages life threats based on simple assessment findings for a patient with special needs while awaiting additional emergency response. We'll be learning about the recognition and management of normal delivery and vaginal bleeding. Those are in relation to obstetrics. And then we will discuss neonatal care, including newborn care and neonatal resuscitation. We'll talk about the definition of medicine for an EMR is when the EMR is able to recognize and manage life threats based on assessment findings of a patient with a medical emergency while awaiting additional emergency response. We'll review gynecology and the recognition and management of shock associated with vaginal bleeding that can occur. To remind you of the EMR definition for trauma, it's when an EMR uses simple knowledge to recognize and manage life threats based on assessment findings of an acutely injured patient while awaiting additional emergency response. We'll talk about special considerations in trauma, dealing with a patient who's either pregnant, a pediatric patient, and geriatric patient. EMRs may be called on to assist in the birth of a child. If you remember some easy steps, you can effectively assist in the birth process and offer comfort and support to both mother and newborn. Childbirth is a normal and natural part of life. You may not have the time or necessary assistance to transport a pregnant woman to the hospital. Your part of the process involves helping, guiding, and supporting the newborn as it is born. Following birth, you should ensure that the newborn is breathing adequately and being kept warm. There will be times when the timing of childbirth catches everyone by surprise or a complication has developed. There are two key indicators of an impending birth: frequency of contractions and the appearance of a newborn's head during a contraction. That's crowning. Let's review some basics for the anatomy and function of the female reproductive system. Ovaries produce eggs. These are the eggs released by the ovaries that travel through the fallopian tubes to the uterus. The uterus, or womb, holds the fertilized egg as it develops during a pregnancy. Developing newborn or fetus is encased in an amniotic sac for support and floats in the amniotic fluid. Placenta, or afterbirth, draws nutrients from the wall of the uterus. These nutrients and oxygens are delivered to the fetus through the umbilical cord. The external opening of the female reproductive system is called the birth canal or vagina. And this illustration is figure 16-1 from your text and is a good slide to identify the important organs and features of pregnancy that you need to understand. When it comes to assessing the birth situation, you need to understand the stages of labor. The first stage of labor is when the pregnant woman's body prepares for birth. This stage is characterized by following conditions. Initial contractions occur, the bag waters breaks, there's a bloody show, which is the mucus plug from the cervix occurs. The newborn's head does not appear during contractions. Check the woman's vagina to determine whether the newborn is crowning. Report your findings to the responding ambulance crew. The second stage of labor involves the birth of the newborn. You will see the newborn's head crowning during contractions, at which time you must prepare to assist the woman with delivery. There is no time for transport if the baby's crowning. The third stage involves delivery of the placenta or afterbirth. You must assist in stabilizing the condition of the mother and newborn and delivering the placenta. But the placenta must also be saved because it has to be analyzed in the hospital and make sure that all of it is there so that none of it's retained inside the mother. The question you should always ask yourself is there time to reach hospital? The following questions will help you determine how close a pregnant woman is to delivery and whether there is time to transport her to the hospital. Is this the woman's first pregnancy? That question is important because a woman experiencing her first labor will usually have more time to reach the hospital. Has the woman experienced a bloody show? If yes, the first stage of labor is about to begin. Has the bag of waters broken? The bag of waters usually breaks toward the end of the first stage of labor and may give some idea of the progress of the birth process. How frequent are contractions? If contractions are more than 5 minutes apart, you can usually transport a woman to the hospital. Contractions less than 2 minutes apart usually indicate that delivery will occur very soon. Does the woman feel an urge to move her bowels? When a newborn's head is in the birth canal, it presses against the rectum and the woman may feel the urge to move her bowels. Do not allow her to go to the toilet. This urge is an indication that delivery is imminent. Is the newborn's head crowning? Crowning indicates that the newborn will be born in the next few minutes. Is transportation available? Is the ambulance responding? How far is it to the hospital? Will bad weather, a natural disaster, or traffic prevent prompt arrival and transport? We're going to talk now about timing contraction cycles. Time contraction cycles from the beginning of one contraction to the beginning of the next. If contractions are less than 3 minutes apart, delivery is close. Observe the vaginal opening during a contraction to see if the baby's head is visible. If you see the head crowning during the contraction, prepare for delivery. Do not risk transporting a woman to the hospital if the child's head is crowning. As you prepare for delivery, keep 2 things in mind. A calm woman means delivery is a more natural process, and calm yourself because it is a natural process and you are there to help. You will not be able to maintain sterile conditions, but you must attempt to be as clean as possible in the field. Wash your hands thoroughly. If you do not have sterile delivery kit, use gloves from EMR life support kit. Have plenty of clean towels ready to cover newborn and help clean the mother. Place the patient on a firm surface that is padded with blankets, folded sheets, or towels. Elevate the patient's hips 2 to 4 inches with pillows and blankets. Place the woman in a comfortable position. This is often on her back with knees bent and feet flat on the surface beneath her. You must always use standard precautions, but as they relate to childbirth, because a woman is in childbirth, they will expand both blood and body fluids. So at the very least, you must use standard precautions during delivery, but try not to get any more blood or fluids on you than is absolutely necessary. And use as much precaution as you have available. Use sterile gloves whenever possible. Follow steps in Skill Drill 16-1 to learn how to put on sterile gloves correctly. Because fluids can splatter on your face during the delivery process, wear face and eye protection. Wear a surgical gown that can help keep fluids off of you. Your emergency care equipment should include a prepackaged obstetric delivery kit or an OB delivery kit, which includes sterile gloves and an umbilical cord clamp. There will also be sterile drapes and towels, sanitary pads, 4x4 gauze pads, a towel or blanket for newborn, bulb syringe, and plastic placenta bag. In addition to an OB kit, you will also need the following items: sheets or towels for mother, suction if available, oxygen if available and you're trained to use it, and newborn-sized face mask. If you do not have a delivery kit, look for appropriate substitute materials. When you're assisting with delivery, bear in mind that there are 2 lives to be considered in this situation: the life of the mother and the life of the newborn. Do not neglect to perform a patient assessment on a woman. Obtain a baseline set of vital signs and repeat them at least every 15 minutes. Throughout the delivery process, continue to monitor a woman's ABCs. Your primary purpose is to assist in delivery of a newborn. Do not let the woman go to the bathroom and do not let her hold her legs together. Be as clean as possible during the entire delivery process. Do not touch the vaginal area except during the delivery. The newborn's head should emerge slowly to prevent undue stress on the newborn and tearing of vaginal tissues. As the head emerges, support the newborn's head and tell the woman to stop pushing. Do not attempt to pull the newborn during delivery. In a normal birth, the newborn will turn to its side by itself after the head emerges, and the rest of the body will be delivered spontaneously. The newborn will be wet and very slippery, so keep the newborn's head at or about the level of the woman's vagina. And these are the steps for assisting with delivery, figure 16-5 from your book. If the amniotic sac has not broken, tear it with your fingers and push it away from the newborn's head and mouth. The umbilical cord is wrapped around the newborn's neck. Attempt to slip it over the newborn's head. If you cannot disentangle the newborn from an umbilical cord, attempt to reduce pressure on the cord. Never pull on an umbilical cord. It is extremely fragile. When it comes to caring for the newborn, you need to clear the newborn's mouth and nose. Use a bulb syringe if one is available. Suction the mouth first and then the nostrils 2 to 3 times until they are clear. If a bulb syringe is not available, wipe the newborn's mouth and nose with a gauze pad. Place the newborn on the mother's abdomen to keep the newborn from losing too much warmth. This is figure 16-6, which shows proper suctioning for the newborn. If the newborn is not breathing, suction the mouth and nose again. Rub the newborn's back or flick the soles of the newborn's feet to stimulate breathing. Use a towel to dry the newborn and then wrap the newborn in a blanket to keep him or her warm. Place the newborn on his or her side with the head slightly lower than the trunk to add drainage of secretions from the airway. When the umbilical cord stops pulsating, clamp it with umbilical cord clamps or tie it with gauze between the mother and the newborn. Note on the time of the delivery so that it can be properly reported on the newborn's health certificate. In a rare event that you encounter multiple births, prepare for second delivery. The placenta usually delivers on its own within 30 minutes after delivery. Never pull on an umbilical cord to help deliver the placenta. Leave the umbilical cord uncut and attached to the placenta and newborn until transporting EMS units arrive. After the placenta is delivered, wrap it in a towel or newspaper with 3/4 of umbilical cord. Place it in a plastic bag and transport it to the hospital. Keep it at the same level as the newborn to prevent blood from the newborn flowing back into the placenta. The mother's bleeding usually stops after the placenta is delivered. If it does not, massage the uterus to help stop the bleeding. Place one hand with fingers fully extended just above the mother's pubic bone. Use your other hand to press down into the abdomen and using a circular motion, gently massage the uterus until it becomes firm. This should take 3 to 5 minutes. So let's talk now about aftercare of mother and newborn. Continue to observe the mother and newborn carefully and keep both of them warm. Cover the newborn's head and body to prevent loss of body heat. Approximately every 3 to 5 minutes, check the uterus for firmness. Recheck the vagina for any excessive bleeding. In a normal delivery, the mother will lose 300 to 500 milliliters or 1 to 2 cups of blood. Continue to massage the uterus using a circular motion if it is not firm or if bleeding continues. Clean the mother with clean, moist towels or cloths and give her small amounts of water to drink if she is thirsty. If you are potentially having to resuscitate a newborn, if the newborn does not breathe on its own within the first minute of birth, proceed with the steps listed in Skill Drill 16-2. There are important complications of pregnancy and childbirth that you need to understand. One of those crises is ectopic pregnancy and shock in pregnant women. An ectopic pregnancy occurs when a fertilized egg becomes implanted in the fallopian tube rather than in the uterus. As the embryo starts to grow, it expands and causes the fallopian tube to rupture, causing a potentially fatal hemorrhage, potentially. The rupture of the fallopian tube causes acute abdominal pain, internal bleeding, and shock. Treat a patient for shock and arrange for immediate transport. A miscarriage or spontaneous abortion is a delivery of an incomplete or underdeveloped fetus. If a miscarriage occurs, save the fetus and all tissues that pass from the vagina, control the woman's bleeding, and treat for shock, and arrange for prompt transport. Vaginal bleeding in a pregnant woman is often the first sign of a miscarriage. Anytime a woman experiences vaginal bleeding, perform a patient assessment, obtain a good medical history, obtain a set of vital signs to determine whether she's experiencing shock, and arrange for prompt transport. A woman who miscarries will be upset about losing the newborn and will need emotional support as well as emergency medical care. Any newborn weighing less than 5 pounds, 2 kilograms, or delivered before 36 weeks of pregnancy is considered premature. Premature newborns are smaller, thinner, and usually redder than full-term newborns. Keep the premature newborns warm because they lose heat extremely quickly, and arrange for prompt transport. In rare circumstances, the bag of amniotic fluid does not break. Carefully break the bag and push it away from the newborn's nose and mouth so that she or he can breathe. Be careful not to injure the newborn in the process. Suction the newborn's mouth and then nose to help him or her begin to breathe. On rare occasions, the umbilical cord will appear from the vagina before the fetus is delivered. The cord will be compressed between the newborn and the woman's pelvis during contractions, cutting off the newborn's blood supply. A prolapse of an umbilical cord is a very serious emergency that requires immediate transport. Place the pregnant patient in a position that raises her hips. Keep the cord covered and moist and do not try to push it back into the vagina. Further steps for prolapsed umbilical cord are to administrate oxygen if it's available, arrange for rapid transport, and some EMS systems recommend placing the woman in a kneeling position to take pressure off the cord. In a breech birth, the newborn's buttocks come down from the birth canal first rather than the head. If you see evidence of breech, which is any body part besides the head that isn't the umbilical cord, then you got a breech. Arrange for prompt transport. A breech birth slows labor, so there'll be a little more time for transport to the emergency department. Support the newborn's buttocks if that's what you see first, or legs as they are delivered, and the head usually will follow on its own. In a breech birth, if the head does not deliver within 3 minutes, arrange for prompt transport. Insert a gloved hand into the vagina and use your fingers to keep the newborn's airway open by forming a pocket over the newborn's nose and mouth. In very rare cases, the arm or leg is the first part of the newborn to appear in the birth canal. Limb presentation is an extreme emergency that cannot be handled in the field, so arrange for the fastest transport available. Sometimes a newborn will die in utero before labor begins. The fetus will generally have an unpleasant odor and will not exhibit any signs of life. Carefully wrap the stillborn in a blanket. Turn your attention to the mother and provide physical care and emotional support. Another set of labor contractions will begin shortly after delivery of the first newborn if there are multiple births. Get ready to repeat the procedures you completed for delivering the first newborn. Sometimes there might be excessive bleeding after delivery. Approximately 1 or 2 cups of blood is lost during normal childbirth. So if the mother is continuing to bleed severely, place 1 or more clean sanitary pads at the opening of the vagina, elevate her legs and hips, treat her for shock, and arrange for rapid transport. Encourage the newborn to nurse at the mother's breast because nursing contracts the uterus and can often help stop bleeding. Massage the uterus with your hand as we discussed earlier. If the area between the mother's vagina and the anus is torn and bleeding, treat it as you would any other open wound. If you're dealing with a vehicle collision and a pregnant patient, the woman should be examined by a physician. The forces involved in even a minor crash may be great enough to injure the woman or unborn child. Promptly assess the patient and arrange for prompt transport to the hospital. If the woman exhibits signs or symptoms of shock, Monitor the airway, breathing, and circulation. Arrange for administration of high flow oxygen, and have a woman lie on her left side rather than on her back. In rare circumstances, a crash can be severe enough to kill the mother, but not the fetus. Provide CPR to the mother while transporting her to the closest medical facility. So let's summarize what we covered in this chapter. This chapter presented skills and knowledge you need to assist in the birth of a newborn. The key indicators when estimating on how soon a delivery will occur are crowning and time between contractions. By assessing these two factors, you can determine whether a woman should be transported or whether the birth will occur outside the hospital. Normal labor consists of 3 distinct stages, which are as follows. Stage 1, which is characterized by the following conditions. Initial contractions occur, bag of waters breaks, and bloody show occurs, but the newborn's head does not appear. Stage 2 involves actual birth. You will see the newborn's head crowning during contractions, at which time you must prepare to assist the woman with delivery. Stage 3 of labor involves delivery of the placenta. You must assist in stabilizing the condition of the mother and newborn and delivering the placenta. Exercise standard precautions when assisting with a delivery. After delivery, you have 2 patients to care for, the mother and the newborn. If the newborn does not breathe on its own within the first minute after birth, proceed with steps to resuscitate the newborn. Although most pregnancies and births are uneventful, you should be aware of possible complications, including ectopic pregnancies and shock, vaginal bleeding and miscarriage, premature birth, an unbroken bag of waters, a prolapsed umbilical cord, a breech birth, stillborn delivery, multiple births, and excessive bleeding after delivery. Keep in mind that childbirth is usually a happy event. You are there to assist in delivery, which in most cases has a happy and healthy outcome. Here are some review questions for this chapter. For the EMR, assisting with delivery involves A, determining exactly when the woman will deliver, B, transporting the pregnant woman only, C, supporting the newborn's head as it emerges and telling the woman to stop pushing, or D, pulling on the newborn to expedite birth. The correct answer is C, supporting the newborn's head as it emerges and telling the woman to stop pushing. Question 2. As soon as a baby is born, it is important to A, cool the baby to stimulate breathing, B, ensure the baby is dried and warm, C, keep newborn's head higher than its body, or D, immediately cut the umbilical cord. This one should be pretty easy for you. The correct answer is B, ensure that the baby is dried and warm. In our third review question, complications of pregnancy include all of the following except A, premature birth, B, prolapsed cord, C, breech birth, D, multiple births. The correct answer is D, multiple births. Class, thank you as always for your time. Be sure to contact your instructor if you have any concerns or if you're confused about anything and need further explanation. Again, thank you for your attention. We'll meet again for the next chapter.